Hello, my name is Martinez, and I'm here to do a focus assessment of upper and lower extremity muscle strength. We're also going to be checking superficial reflex. In this case, we're going to use the Babinski reflex and the patellar tendon reflex, also known as the knee jerk response. Before I start my examination, as always, I will wash my hands thoroughly, and I will introduce myself to the patient. Justin has agreed to help me out with this examination, and we're basically going to be examining upper and lower extremities and how to test for motor strength. Where I work at, we have a grading scale of 0 to 5, where 0 being a flaccid patient unable to move his muscles, and 5 being a normal patient with full range of motion and full strength against resistance to the joint. So the main thing to do when testing for motor strength is to assess what we're doing is we're assessing the major motor groups of the muscles. And we do this by applying force while they're performing a certain movement. We're going to start from top to bottom, and then we're going to go from proximal to distal. With Justin sitting here, of course, if he'd be wearing a robe, and we'd be keeping him covered up and exposing only the area we're going to see. So we're going to start with the shoulders now, and we're going to assess shoulder strength by having him shrug. Not only does this also gives an opportunity to see the strength of the shoulders, but it also lets us test the cranial nerve 9 function. So we'll ask him first to go ahead and shrug his shoulders. Justin, please. He brings both shoulders up to his ears. He adducts, and they're equal and symmetrical. Now we're going to go ahead and palpate while he does it, and for some resistance. Go ahead up. Good. Equal and strong on both sides. We also were able to feel for any kind of crepiness when he goes up. So we would have to give him a 5 on this. Now, another test we use is extend the arms out, Justin. And I'm going to press on his arm and have him resist my pressing. I'm going to press down and have him press up, and then I'm going to press up and have him press down. So, Justin, I'm going to press down, now you press up. Good equal grip strength. Now I'm going to do it the opposite way, and now I'm going to push down, and you push up. Excellent. So we're able to see both sides that he can push up against resistance and down, equal and symmetrical. We're going to go to the elbow now, and have him extend and flex both sides. We see that he has a symmetrical manner to it. They're both equal. I'm going to have him bend one elbow up, and I'm going to support it, and I'm going to push, and I have him pull down. Good. He has good strong resistance. Now I'm going to do the opposite now, and pull, push, while he pulls up. Good strong strength. Let's try this side. Same thing. I'm pushing up. He pushes down. Good. And now I push down, and he pushes up. Both were strong and equal. We're going to check his wrist now, and have him supinate his arm here. I'm going to support his arm, and I'm going to have him push upwards with his wrist and extend and flex and extend. So push up while I push down, and now push down while I push up. Good. And let's do it with the other hand. Same thing. I'm going to support his arm, push up. Excellent. Push down. Good. While we're here, I'm going to kind of jump into here a little bit and go out of turn, and I'm going to check his patellar reflex, the knee jerk reaction, because it's much easier to test somebody's knee reflex while they're sitting and the leg is dangling. So I'm going to have Justin go back a little bit, and I'm going to take out my handy dandy hammer, reflex hammer. I'm going to have him keep his leg dangling like this, nice and free. Try to relax your leg. And I'm going to hit him just above the tendon. And it should elicit that knee-jerk reaction. This is normal. So that's what we're looking for when we do the knee-jerk reaction, reflex. I'm going to have Justin now walk over to the couch and have him lie in a supine position. And we're going to finish examining his lower extremities. Justin, if you don't mind. While walking over there, we can observe his walking. He has a good symmetrical gait. He walks evenly. He doesn't seem to be in any kind of pain while walking. and just lay down there. Excellent. So that's an easy way of examining that. So now we're going to go down to his hips. I'm going to have him raise his leg. And the same thing we did before with the upper extremities, you're going to do with the lower extremities. I'm going to push, and you pull down, Justin. I'm going to push up, and he fights down. Good. Now let's do it the other way, where I'm going to pull, and you push down. Okay, we'll do it with the other leg. Relax your leg. I'm going to push upwards, and you push downwards. Good. And now I'm going to pull downward, push downward. Excellent. Do the same thing with the ankles. I'm going to have him bend down, bend his feet down, and extend them, like he's stepping on the gas, and then flex his toes upwards, like the toes to the ceiling. So let's do it first. Step on the gas, Justin. Press your foot down. Excellent. Now foot up. Good. Do it on this side. Step on the gas. Good. Toes to the ceiling. Good job. Nice, strong, and equal on both sides. The final thing we're going to do is check for his Babinski. Now, Babinski is a sign of upper neuron damage, really. On kids less than 2 years old, they might have it. Once they grow out of that, you're not going to see it. So ideally, we do not want to see a Babinski reflex on that. It's done by taking the foot, sorry Justin, and going across the foot from the bottom up and across the toes. That's a normal response, bringing your toes down. If his big toe were to go up and his toes were to fan out, that would be a positive Babinski, and that's a sign of an upper neuron damage. So that was a normal response. We'll do it again here. Again, we start across the foot and go across the ball of the field, and his foot turned down. So that's a negative response. That's it. Thank you very much.